So welcome to the forum. And somewhere, he's not here yet, but yes, he is. He'll put his camera on in a minute and introduce himself as the current vice chairman, Adrian.
Hi, everybody.
Yeah.
Me. Yeah, Adrian Acre. Sorry for the delay. I've just literally just come back from the RUH with the wife, so she's all right, so it's fine. But we just you had a few days in the RUH with her.
Oh gosh.
We're okay. So just through the door. So thank you very much.
All right. Well, it's very kind of you, Adrian, to sort of come on in that situation. Right. So we're looking forward to hearing from our speakers this evening, and from any of those that want to say anything, feedback, suggestions, etc. Please remember to sign in to the meeting so that we have a record of who's attended, and can assure you, and then we put you on a mailing list. Do you know what? I hate chairing and reading what I'm supposed to say, but there we are. And also just to remind everybody that the meeting is being recorded. So should you have any issues about that, please let us know. And we've received apologies from Councillor Andy Waite, Councillor Duncan Hansel, and Councillor Paul May. We're moving it around a little bit. Well, I don't know whether you've got an agenda, and if you haven't, well, you'll follow the one we've got. So tonight is also the AGM, but before we would normally go into the AGM, I'm going to welcome our first presenter, who is Dan Wood, who is the Operations Director for Baines Enhanced Medical Services. And looking around is Dan Wood.
It's me. Sorry, it's Dan Smith, actually.
Oh, is it?
It is.
Sorry about that, Dan.
But
anyway,
I'll take a Dan Wood. It's fine.
All right, you're more than welcome. You've got a quarter of an hour. What I will say to all speakers, we're going to try and stick to the time tonight, please, because it becomes a little bit difficult if everybody overruns by 5 or 10 minutes. And it also means I miss the start of Coronation Street. So, Dan, over to you.
Lovely. Thank you very much. And thank you for moving your agenda around to suit. Unfortunately, I've got another meeting to join at 7. So it's very kind of you to move things around. I have a very short presentation to go through, actually, to explain who Baines Enhanced Medical Services are, what we are, why do we exist. Before I start the presentation, I want to sort of get a sense from the room. We're a type of organisation that's called a GP Federation. Has anyone in the room ever heard of a GP Federation, or is it a lot of blank looks like what on earth are you on about? No, I'm starting from scratch, right? Great. So hopefully by the end of this short presentation, you'll at least know what BEMS is, and then some time at the end if anyone's got any questions. Just share my screen a second. Hopefully that's worked. Can everyone see that?
Yeah, looks okay to me.
Perfect. Lovely. Thank you. So, who are BEMS? So yeah, it stands for Baines Enhanced Medical Services. We're a not-for-profit organisation, something called a community benefit society. Essentially what we are is we are an at-scale provider for the practices in Baines, obviously including Keynsham. So there's currently 20 practices in Baines, and way back in 2004, so 20 plus years ago now, general practices worked together to provide out of hours. So that's kind of like the equivalent of calling 111 now. And the practices in Baines, they wanted an entity or an organisation to work together to be able to do that. And so they formed Baines Emergency Medical Services. So that was BEMS 20 years ago. The NHS has changed a lot in 20 years, as I'm sure you'll all be aware as service users. And we started as an organisation to do a lot more than just the out-of-hours service. And so about 15 years ago, we changed the E from emergency to enhanced, just to keep the BEMS acronym, but to show that we do a little bit more than out-of-hours. And actually, we are no longer the out-of-hours provider, but we are a not-for-profit service. As you can see, I've got our aims and objectives there. I'm going to basically run through those quickly and give you a little bit of a flavour of what we do. This is a little map of Baines. It shows the 20 practices that are in Baines, and as you can see at the bottom there on that list on the right-hand side, we've got Keynsham, which is now actually 2 practices, St Augustine's and Westview, although I think between them they have 4 sites because they've both got branch surgeries as well. So that's the area that we cover as a membership organisation. In terms of the scale of our team, we've got a head office team, as you can imagine. We have lots of doctors that work for us. We have lots of nurses. We run something called the DVT service, which means we have vascular scientists. And we also have some administrative staff that work in something called enhanced access, which is where we provide general practice appointments in the evening and the weekend, basically. It's a bit of a funny old question of how many people do we employ, because our head office is really only about 20 staff. But as you can see from here, we have lots of clinical staff that we employ what's called on a sessional basis. So there are employees, but they might just pick up the odd shift here and there. So we have about 150 people on the books, but only 20 of us work at head office, if that makes sense. These are generally how I describe what we do. So we provide some clinical services. We do a piece of work around workforce and education of general practice staff. And we also have a role partnering and collaborating with other organizations. So I'm going to run through them quickly, basically. In terms of clinical services, we run a bunch of clinical services, not just this, but to give a flavor, all of these are community-based services. So essentially, these are about providing services closer to home. So we run a DVT service where we scan patients in the community. Enhanced access is evening and weekend appointments with the GP or nurse. Again, dermatology service is hosted from general practices, 3 across Baines. We run a fracture and soft tissue service, again, from Poulton Hospital and Soulis Hospital, as well as a general practice in Bath. For the last 4 years, we've ran something called PUSH, which is Pediatric Urgent Service Hub. That's over winter when things are extra busy and there's a lot more sort of respiratory illnesses around. That's acute same-day appointments for children that are feverish and unwell with the respiratory conditions. And we also run something called CMDU, which is the COVID Medicine Delivery Unit. You might remember a couple of years ago when COVID sort of first started, some residents and patients were called something called clinically extremely vulnerable. Roughly that cohort of patients are eligible for antiviral treatment if they catch COVID, even to this day. So we run a service prescribing antiviral medication for a cohort of people that catch COVID, which is obviously still rife. And we also actually provide the doctors within UTC. So when you go into the emergency department in the IUH, it's called streaming. You're triaged and you're streamed to the right service within the emergency department. And one of those is a GP-led service, and it's called the Urgent Treatment Centre. And we provide the GPs. So we do have a presence in the emergency department as well, amongst many other clinical services. The raison d'etre, if you will, of why we would provide a service is kind of largely twofold. One is we try to provide services closer to home. So a lot of these services, before they existed within the community, you had to go to the hospital, but they're not services that you have to go to the hospital for. So it's really about bringing those services out of the hospital, closer to home, easier parking, free parking. And the other one is that we tend to use general practice and general practice workforce. So again, a lot of this, you don't have to see a consultant dermatologist all the time for everything dermatology related. You can, as a GP, you can train to be a specialist in a certain thing as well. So a lot of our services, our fracture clinic, our dermatology service, and others are GPs that are trained to be specialists, which enables us to just have a bog standard GP consultation room, but see a specialist service. I'm always proud to show our patient feedback. This is from a collation of last year, but as you can see, really, really positive feedback across all of our services, which we do try and shout about. So really proud of that. And we also do a lot of facilitated posts. What I mean by that is there is sometimes money to employ people to work on projects that it helps that we can employ that person for all 20 practices, because without a GP federation, one of the practices would have to be like, oh, I'll employ the person, but they're working for all 20 practices. It's much easier for us to be the membership organization that can host them. So it really gives more opportunities for some of these roles to be working in general practice, because we exist to be able to employ those people across the whole area, as opposed to, which practice is going to take the risk of recruiting and taking a member of staff on. And we have a role doing that quite a lot. In terms of workforce and education, we used to run something called the Training Hub, which we now are involved in, but it's actually provided at a bigger scale than Baines. So it's actually provided at Baines, Swindon and Wiltshire level. But we still hold a Baines Training Hub meeting, and that is really about making sure that training and education is available for staff within general practices. And a lot of that helps us provide the training for GPs to become specialists in things, which then enables us to set up community services. So it all kind of starts there a little bit. And we do lots of things like nurse conferences, and we do forums for deputy managers. So we really try and bring workforce together and share training, education and learning, again, across all 20 practices. Partnership and collaboration. So I'm going to show you a horrible slide here. This is a sample of some of the meetings that happen in the NHS, and I do mean some. It is a big, cumbersome, bureaucratic thing in the NHS. And there are lots of meetings and lots of people that are involved into, the general strategy and direction of the NHS. What I'm trying to show here is that as a GP federation, most of our executive team, actually apart from myself, are really substantive staff working in general practice. So we have a practice manager, we have 2 GPs, we have a practice nurse, and they work for us, 1 day a week. But because they're day-to-day in general practice, they help other leaders within general practice attend a lot of these meetings. There are a lot of meetings to go to, and you have to remember that general practices are individual businesses. There's 20 practices in Baines. That's 20 independent businesses. And when it comes to system level meetings, it is very easy for the RUH to send a couple of staff. I know Phil is talking about HCRG later in this meeting, and HCRG are able to send a member of staff, and that represents all of the community services. Well, actually, how can 20 general practices be represented fairly in those meetings? We help by being able to go to those meetings and making sure that general practice has a voice and contributes to the direction of the NHS, and it isn't just the hospital or community services or mental health trusts. Because we're a GP federation, what we try and do with the staff that we employ is add benefit as well, because we don't want to just be an organization that provides clinical services. How does that help our practices? Well, because we employ staff related to running services, it enables us to provide free services for our memberships. We provide lots of project management support. As you can see here, a small sample, we do staff surveys for them. We review their websites for them. We moved office this year and we gave a bunch of furniture out to our member practices for free. So we try and add value where we can to our members, as opposed to just being, any old provider of NHS services. This is an example of what I mean. These are some of our 20 head office staff, and this is something that we share to all of our practices. And we say, look, if you're having a problem in practice, or you want to run a project, or you want to try something new, ask us for support. These are all the people we employ. These are all the skill sets they have. Ask us first. And 9 times out of 10, we can help you for free. We're already here in the office doing stuff, so why not help a member practice as well? So that's something we've been doing a lot more of over the last couple of years. Just a quick bit on looking ahead. This year we've started running the outreach vaccination service. So that's providing COVID and flu to areas where there's low take up. So things like homeless people, or there's lots of sites in Wiltshire with military families that don't take up vaccines. So it's a whole program based on uptake of that. We've been doing something called the Roadshow. So myself and the chief exec, we've been going to every single one of our members' partners meetings to really make sure we stay connected with each individual practice as a member. We've started a couple of different services as well. So one is called image taking hubs, where we take high resolution images of lesions and moles, and that enables the hospital to triage those images without having to bring people into the hospital. So historically, people would be brought in so the consultant can look at it. Well, actually, if we take a really good image of it, they can do that remotely, and 8 out of 10 patients then don't have to go to hospital. So it's really saving consultant time and it's saving patient time. And then just a little bit on the future strategy of BEMS. So the 10-year plan has come out, which I'm sure Phil will also talk about with HCRG. But the 3 tenets of the 10-year plan are analog to digital, hospital to community, and sickness to prevention. As a GP federation, that's our jam. That's the stuff that we love, and that's the stuff that we're already doing and want to do more of. So we're sitting in a really good place to help push forward that 10-year plan. Certainly hospital to community, as hopefully you've already picked up a lot of that. There are lots of things going on in the hospital that don't have to be on the hospital footprint. And we would love to see those things come out into the community. As you can see here, we're already working on with the ENT department and gastroenterology on some possible services to bring them out of the hospital. And we're also, although we're a BANES organization, increasingly, like CMDU and the vaccination service, we're providing services across a bigger footprint. So our membership very much stays as BANES, and that's the B in our name. But we are starting to work over a slightly wider footprint because the scale of the NHS has changed over recent years, and BANES has become part of BANES Swindon and Wiltshire. So lots of services are being procured at that bigger level. So we need to be able to play at that level. Otherwise, there just wouldn't be services for us to run anymore. And that's it. Sorry, I was conscious of time, so that was a real whistle-stop tour. But that is, how am I doing? I'm just running out of time, aren't I?
Yeah,
that's a whistle-stop tour of BEMS.
Beautifully timed. Thank you for that. Could I ask, will you make your presentation available to Mark and Sarah?
Absolutely.
Then,
I sent it to Mark earlier today, actually.
Oh, that's lovely. So, Mark, can you share it around all of the attendees? Because there's a great deal of information in there which would be worth everybody having a look at. But yes, thank you very much for your time.
Thank you for having me, and enjoy the rest of the meeting.
Okay, thanks. Bye.
Thanks, everyone. Bye-bye.
Right, now we're moving on. The forum's AGM is this evening. As it might have been said earlier, I'm not quite sure. But both Adrian and myself are pleased to stand for our respective roles again. But equally, if there are any nominations from the floor, then we will take those. So give people a moment to think. Okay, that's long enough. All right, so you've had the notes of the previous AGMs, and can you agree that they are a true record? If you can remember last year's, yeah. Okay, that sounds good. And the AGM report for 24-25 was also circulated in advance of this evening's meeting for you to note. And it highlights what the Keynsham area forum has covered over the past year and an overview of the council's Connecting Communities programme. So we thank you for your continued input. I'm going to hand over now to Sarah to deal with the election and one or two other things.
Thanks, Alan, and apologies. For some reason, our Wi-Fi in the hub today is dipping in and out. So apologies if I go off screen or I have to turn my camera off. So apologies in advance for that. Just a couple of items just for consideration. The first one is the terms of reference. So we would like to propose that there is a slight change to the wording of 5.7, which relates to the membership, and it talks about members of the public being invited as observers only and not allowed to speak unless the pre-agreement with the chair and vice chair. What we'd like to do is change that to be more softer and more inclusive, to say the members of the public may speak, participate at the chair's discretion. So if everyone is happy with that change.
Anybody against? No.
That's great. Thank you. And the other proposal is obviously for new members. And Alan and Adrian, I think you might have some recommendations for new members. And I note that we've got Barbara Butler from the Neighbourhood Watch team, and I didn't know whether we'd like to invite them also to become members of the forum. What that means is that you will join the mailing list and we will circulate the details, and you can participate in the AGM at future meetings. So there's very little commitment in terms of participation, but it's a good way of connecting to information and also for us to hear from yourselves as well. So I don't know whether Alan and Adrian wanted to put forward any names for organisations to join at this point.
Adrian, I think you did, didn't you?
Yeah, thank you very much. Yeah, following Mark's email, actually, I spoke to the trustees of Butterflies Haven, which I'm a trustee as well. around the possibility of membership. They fully agreed it. I think it's good. As far as I'm aware, we haven't got any organisation that work with those groups of people with neurodiversity issues. Butterflies Haven, for people that don't know, we basically based in Keynsham, and we work and support families with autism and related things. Really, we're not specifically got ADHD and stuff like that. We invite people along on a Monday and a Friday. Monday we run a group for older young people up to about 18. And on a Friday, we do it from young people from 4 up to about 12 years of age. We don't ask for a diagnosis, which is very, very helpful. A lot of organizations do. We don't. The only criteria is whether we can meet the needs of that individual young person or no. If we can, then we will work with them. We have presented to the forum in the past, and we've been around for quite a few years in Keynsham now, and it's very well established. So I think it'd be good, and it has certainly enhanced the base of the membership of the forum. So I'd like to propose that we accept them as a member of the forum, please.
Quite happy to second that.
Thank you. We've also got to note that there is Keynsham, Community at 67 have changed their name to Keynsham Community Hub. So that's just a note. And Transition Keynsham have requested to come off the membership. And I don't know whether Barbara Butler and the Neighbourhood Watch team are happy to be put forward just as a formality.
Can I just say that Judith Bryce, who's also present, is a fellow Neighbourhood Watch coordinator. We're for Salford.
Great. That's
the two
brilliant.
of us.
Fantastic.
Okay.
Chris?
Sorry, I haven't used Teams before, so I'm not familiar with it as I'm with Zoom.
No, that's fine. You're doing really well. Thank you, Barbara.
Chris has got a hand up. Chris Hansel.
Hi. Just a comment about the business representatives.
Yeah.
I'm not sure that Keynsham Chamber of Commerce still exists. You
Right.
might want to check that.
Okay, thank you.
And Salford Business Association is actually Salford Business Network.
Okay, we'll make that change. Thank you, Chris.
And the other thing is, I think there are a number of neighbourhood watch groups.
Yeah.
And it's interesting. I mean, I think it's great that Judith and Barbara are represented. But if you are going to invite one neighbourhood watch group, should you be messaging others or asking for them or something of the sort?
If people are happy with that, we can invite them to future meetings, and then we can ratify it at the next AGM.
Yeah.
Barbara.
Can I please just say that Judith and I are coming on because we felt very isolated after Salford Council stopped running the Neighbourhood Watch meeting for the coordinators once a year. And we really missed that because it was a chance to meet the coordinators from the other villages in the area. And we've only just recently found out that the area forum doesn't mean just the area of Keynsham, but actually is supposing to include the other villages. So we've just come along to find out what's what, and perhaps to hear the police report, because we can never answer questions from the people in the village who say what's happening, because we're not kept in the loop of with the other neighbourhood watch coordinators. I'm afraid data protection means we are isolated and we don't know who the other people are.
Sure.
Okay.
Thank
Lottie's
you,
got
Barbara.
Oh.
her hand up.
Yes, Judith's nodding.
Lottie's got her hand up.
Thank you, Alan. Sorry for my apologies being late. I was stuck in Bath traffic, but I'm pleased to join you. It's just to pick up on the points made by Barbara, and apologies for missing what may have been said beforehand. The Parish Council has advised that Neighbourhood Watch group can organise their own meeting. As you know, it's not a Parish Council responsibility. So this is something that coordinators can do. I think the issue that Sarah might find, following on from Barbara's very good point to invite everybody, is that only the Neighbourhood Watch coordinator for Avon and Somerset Police actually have the details for the other Neighbourhood Watch groups. So, you know, I really hope that your contact with them is successful and that you can invite other neighbourhood watch groups. But I know that Barbara's also struggled. But just to say, the parish council doesn't have these details either, obviously, because we're not, this is the Navan and Somerset Police initiative. So, and I did mention to Barbara, come along, because this is where the police have told parish councils they're unable to attend our meetings anymore. They are very pressed on resource. We appreciate that. I'm sure if there was a major issue in the village, then they would. But, for these updates and things, this is why we've said come to the Keynsham Area Forum. So thank you very much for always having the police as a standing item on the agenda as well.
Thanks, Lottie.
Thank you, Lottie. Yeah.
Rob, is your hand up in relation to this, or?
No, it's up in relation to this. Obviously, I've been in touch with Barbara recently. I don't know who said that. I've been here 18 months and I'm more than happy to attend meetings with the Neighbourhood Watch. However, as Martin and a few others will note, I run sort of every 6-8 weeks or so, Barbara, what we call a solutions meeting in Keynsham. So I meet with the local councillors, I meet with sort of shopkeepers and headmasters. I'm more than happy to invite you into that meeting, just so that you can keep up to date. At the end of the day, for me, I want, and I think Martin will hopefully back me up on this, my personal reason for being in these meetings, and you'll find I will be in every single meeting, is that I want you guys to be able to get in touch with me at any point that you need to get in touch with me. Mark Hayward's aware as well. You guys are always welcome to come into the solutions meetings and vent at me, as it were. I'm here. I see myself being here for at least the next 10-12 years or so. I don't plan on going anywhere unless they force me out and drag me out, to be perfectly honest.
Thank you for that. Can we just refocus? Because this is just, I understand the responses, but it's starting to broaden out. So back to Sarah, just to finish the AGM.
So thank you, and it's a really good point. What we'll do, unless we have any objections, we will take those changes to those transition Keynsham and the changes to Community 67 acknowledging their new name, Butterflies Haven as a new member, invite the neighbourhood watches, and unless we get any objections, then we will proceed and invite them in as the forum members, and they'll join the mailing list. So unless I see anybody that's against that proposal.
So could I just add Keynsham Talking newspaper?
I'm sorry, Alan.
Provisionally. Yes. And also Keynsham Mencap. I haven't spoken to them, but I think they would be appropriate as well. But I will speak to them. Yeah.
Thank you. And we'll double check about the Keynsham Business Association as well and make that Salford change. So if everyone's happy with that, that's great. And then the final bit of AGM business is to accept the chair and vice chair's nominations. So we have Alan as happy to stand again as chair, and Adrian Inker as vice chair. We haven't had any other nominations, so would anybody like to either put themselves forward at this point? No. Okay, and so are we happy to accept Alan and Adrian's nominations to stay as chair and vice chair for the following year? Is everyone happy with that? Yeah, that's great, lovely. Any objections to those nominations? No? Okay, that's great, thank you. And back over to you, Alan, thank you.
Okay. Thank you to all of you, and I'm sure Adrian is also very grateful. So moving on, Rob, we're coming to you now for your 10 minutes, please.
I think I just spoke for 10, didn't I?
Well, didn't notice anything.
That's right. Good evening, everyone. Thanks, long time caller, short time listener. I don't know which way around that should have been. Rob Turner, I'm the neighbourhood beat sergeant at Keynsham. I know some people, I've been in contact with others, but generally my main reason for being here this evening is I'm the face that I want you all to see. I'm the senior ranking officer in Keynsham. Yes, I have an inspector, but predominantly they work over in Bath. And I want everybody to know who I am, know that they can get in touch with me. And as Alan discovered on the weekend, where I can, I will act as quickly and as swiftly as possible to try and counter any issues. First order of the day, I'm well aware that the website shows that I've got 1 PC and 3 PCSOs. If you look at the Chew Valley one as well, the 3 PCSOs work everywhere. I've got 2 new PCs beginning with me in the next 2-3 weeks. So by the start of December, I should then have 3 PCs and 3 PCSOs. And my plan moving forward is that will enable me to work on things like building intelligence around, not to scare anyone because it's not a serious issue, but building intelligence around any drugs, antisocial behavior. And one of the things that is irking me, and I haven't been able to throw anybody at it at the moment, is e-scooters, e-bikes, and the nuisance that they cause. So I can see a lot of nodding on that. And yes, it bugs me as well. E-scooters are illegal, but I can honestly tell you, unless you are catching people red-handed, they're an absolute pain in the backside to jump on. So that's where I am. I'm not going to kill everybody with stats. I know with the Keynsham meetings that I hold, the solutions meetings, I am more than happy. So those solutions meetings, I'll touch on again, Barbara, as I was just saying, I'm more than happy if you put your email in the chat. I will add you to that invite because, as you rightly point out, Keynsham and Salford are sort of one area, and then the other one is Chew Valley. No, there's not the worst problems in the world at the moment in Salford coming across my radar, but I'm also aware of the antisocial behaviours that are happening. And when summer picks up, I'm well aware of what happens down at the shallows and on the cycle path and everything else. But touch wood, at the moment, we've had quite a lot of success in relation to reducing the antisocial behaviour on Keynsham High Street. That was done, if nobody has seen the recent article in Somerset Live or Bristol Live or anything, that was done just by absolutely hammering into the problem persons and taking what was a core group of sort of 15 to 20 and reducing them gradually all the way down to what we now have as 2 or 3 individuals who unfortunately we would probably be looking to progress towards criminality as opposed to antisocial behaviour disposals. Not nice, but we can only go so far with nicey policing. Yes, I will, Lottie, not a problem at all. Where was I? Lost my train of thought. So yeah, one of our main focuses was antisocial behaviour, mainly around Poundland and Market Walk. One of the things we've done, if people aren't aware, there's a Crime Stoppers zone there now. The councillor assisting by setting up the disc scheme. Now, I know there's no shops in here, but the disc scheme is basically like a WhatsApp between all the shops that sign up to it to be able to say, so-and-so's on the high street, keep an eye out. So that's something that's been introduced. And yeah, the other thing was just by absolutely tackling those main offenders. So we saw in the 12 months from March last year, when I first arrived, to March this year, a 50% reduction in antisocial behaviour. Now, I'm not going to sit here and pretend that was all down to me or anything. That was down to hard work by my cops and my PCSOs getting out there and getting in people's faces. But the difficulty with being myopically focused for a period of time on the high street was there were issues elsewhere. And I'm well aware that a few of the parks got used for, shall we say, sexy time purposes, I suppose is the bluntest way of putting it. And I'm aware that there were areas where strong smells of cannabis, and that's part of why I do the solutions meetings as well, so that people can come in and also push those to me. So whilst you guys will get sort of 3 monthly updates, as Martin and Mark will say, every sort of 6 weeks or so, I host those meetings to be able to have you know, an open forum, as it were. My view is that every single person that wants to get in touch with me should be able to get in touch with me. No, I can't promise that it's going to be 100 mile an hour like it was, Alan, on the weekend, but where I can, I try and remedy things as much as possible. Tim, for example, his team have helped me recently with doing a fire check with the travelling community down on Durley Hill, so in the bus gate. Be assured I'm working on that behind the scenes, and Tim, thank you and your team for helping me out with that, buddy. But yeah, we're looking at all sorts of things at the moment. They're just all behind the scenes. One thing I will raise to everybody, if it hasn't come across your radar, some of you are councillors. Are you aware of this new Wi-Fi pod that is being proposed to be set up outside Poundland on the High Street?
I've objected to it.
Yep, I'm strongly objecting to it. With our member of our designing out team, I can see Martin nodding his head as well. I'm sure Poundland will object to it. I suppose what I'm saying here is that please, 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 can I confirm objections? I can't sway you. I can't sit here and say you must object. Obviously, that's not my case to do, but the want of setting up a free Wi-Fi / charging station outside an area that was my highest antisocial behaviour hotspot for the last 12-18 months is not something that I am prepared to support. So I can't. If it happens, then so be it. But all I can see would be a spike of kids on scooters, kids right outside Poundland, and to be honest, working with their staff, we've seen a massive reduction in shoplifting and ASB with them, because both Broadlands and Wellsway helped us identify a lot of young persons that were shoplifting in the area. I've waffled, but quite simply, my main focus is that you all know who I am. You all see my face. I've been a cop for 22.5 years, and I intend to be here for good. Thanks, Martin. Very glad to hear that. Chris, not a problem at all. That was absolutely fine. Thanks for the email. But yeah, so for me moving forward, I just want everybody to know you can get in touch with me. Please, not for reporting crimes, but you know, for the things whereby, you know, sending PCSOs out to check cars that are parked on grasslands and on verges and things like that, as Alan did on the weekend. No problem with doing that. But yeah, if you've got crimes, obviously still report those either online or via 999. And then I see it says, and questions. This is the bit where sometimes it goes wrong for me, but I'm prepared. Any questions?
Doesn't look like it.
Come on.
So can't be bad. Could you add
Can't be
my
bad.
could you add my
Oh, there we
email
are.
address to your circulations?
Yes, of
Or
course.
to your meeting, I mean. Yeah.
Yeah, no, not a problem at all. I didn't realise
Right.
you weren't already in the invites.
No.
Mr. Hayward, your hand was up first. Barbara,
Oh, sorry.
right at the top, there's a raise hand option. I can see you putting
Sorry,
your hand up.
I was just coming in to let Alan know that Tim Stevens is here from the fire service.
Yeah, I've got Tim
just
sat in
so that
front
you're
of me.
aware. Okay, thank you.
But we'll just take one from Barbara then, and
Go on then, Barbara.
then we can keep nice and focused.
I've just if you've got my email address, Rob.
I have.
Yeah, I wondered, do you want me to send you my phone number or about these so I can give you details of these meetings?
No, that's absolutely fine. Email's always best for me, simply because I'll say this to everybody. For me, I keep 99% of my emails in separate folders so that I've always got an auditable trail of contact. Whereas mobile phones, it's very easy to get lost on mobile phones. So yeah, email is always best for me. Anything else from anyone? Well,
I was just going to say, is it all right if Judith, who's also present tonight, is the only other neighbourhood watch coordinator I know? Is it okay if I share everything with her? I'm afraid I don't know any of the others because Trevor never answers my email.
Don't worry about it. Behind the scenes, I can get the information of whomever is neighbourhood watch, and I can also request them in. But as long as people just pop their emails in the chats, I will add them to the email to the solutions meeting. Hands went up and then hands popped down, but Lottie's is up.
Yeah, it was just exactly what Barbara was pointing out. The parish council would be really pleased to share about the solutions meeting with other neighbourhood watch groups in Salford. I can email you about it, but the parish council's got quite active social media. So if it was maybe a way that we could connect up the other neighbourhood watches with the solutions meeting, let them know about it happening as well. Would that be fine with you, Rob?
Yeah, it's not a problem at all.
Great.
Like I said, I want to be as visible as possible. So
Perfect.
I want people to know who to get in touch with if they've got problems, because at the end of the day, as much as this sounds like a very managerial word, I want the accountability. So
That's great. Thank you very much. I'll drop you an email and we can talk about how to get the word out. So thank you very much.
no
Thank you,
worries
Rob.
at all. I shall cede the floor to Mr. Stevens, I believe,
Yeah.
is next.
Tim, over to you. Is Tim all right, or do you prefer Tim?
Yeah, Tim's fine. Yeah, good evening, everyone. Just I'm the crew manager here on Greenwich at Hicksgate Fire Station. Yeah, just logging on really. We've only got a sort of short period of time, but happy to answer any questions from anyone really. Like Rob's saying, the only thing to really add sort of locally is we've done some sort of intervention across the road from the fire station with some caravans. We don't have many powers in terms of anything other than just making sure there's sort of fire safety and just awareness really with the residents there. We're doing a lot of stuff prevention-wise at the moment, businesses, particularly around the local area, and just collating some information and data on that. And it's just to remind everyone that they can access our website, that anyone can try and basically, we go out to properties and we do home fire safety visits. So we do this regularly. We do this with certain individuals and people. And it's really just to remind everyone that anyone can access our toolkit. It's on the main page of the internet. And then just follow the steps from there. And we can pop out and basically fit smoke alarms for people that need them and just give safety advice. So yeah, if there's any questions from anyone, yeah, I'm here for a very short time.
It looks as though you got off scot-free, Tim.
Yeah, nice. So yeah, we're always around, and like I said, in terms of the local area, yeah, we're mainly aiming our stuff at prevention at the moment.
Thank you very much for coming. It's always worthwhile. Thank you.
Thank you.
Okay, thank you, Rob, as well. So we're moving on to the movement strategy, and the person who's going to tell you all about that is Sam Taylor, who's senior engineer in the active. We'll speak about them. No, the typing's gone a bit awry here, Sam. You tell us
Yeah, of
what
course,
you
yeah.
do.
No worries. So I'm Sam Taylor. I'm a senior engineer, actually not within the active travel team, but within the strategic transport projects team. So we kind of sit between like our policy team, who will come up with a lot of the strategies. We'll kind of take it through, and we'll either work, kind of support them as and when there's like resource constraints, but we also then work with some of the delivery projects to ensure that the benefits are being realised. So we're kind of a mix of kind of what's going on between a couple of different projects around the council. But today I'm here to speak about the movement strategy for Bath, which I know this is a Keynsham area forum, but we wanted to kind of recognise that actually whilst 36% of movements within Bath happen within Bath, so they start and finish in Bath, actually 64% of movements are actually trips either to or from Bath or trips going through Bath, which means it's actually impacting all you guys living out in outside of Bath, really. So the last thing we wanted to do is make you guys feel left out. We want to make sure your voices are heard as well. So the main thing really to say on this is the movement strategy is out for public consultation at the minute. I will put a link into the chat on the website. But essentially, it is following on from our Journey to Net Zero document. And what that stated was that we have a climate emergency. As of 2023, our carbon emissions from transport are the biggest. So we actually, transport accounts across Bath and North East Somerset for 36% of carbon emissions. So it's the biggest sector. And so we want to do our bit in trying to reduce that, especially because we recognise that we've got there's growth coming across the region. So you might have seen like the local plans obviously been out for consultation the last few weeks. And so this is recognising that, yes, there's going to be a housing growth. Yes, there's going to be more people living in the area. And so what that means is that we're going to see probably about 74% in people's current journeys through Bath. And so what that means is, say you take a 10-minute travel through Bath, that means by 2036, your journey is going to become 17 minutes. So whether you're in an EV car, which yes, helps with the congestion element, you're still going to be sat in traffic. So what this is trying to do is recognise that Bath is a World Heritage Site. We recognise that, but it also then means our road widths are very restricted. And so we want to try and make sure that everyone can keep moving the best way possible. And so what it tries to do is identify a key corridor, which will be safeguarding those movements for through traffic. What it then does is also identify where our key corridors are for buses, and so that means when any funding becomes available for through the council, we would look to prioritise bus infrastructure on those corridors. And then what it also does as well is links in with our active travel master plan that was adopted earlier this year, so that identified where those key primary and secondary corridors are for active travel. It's a 10-year aspiration for the council, and the whole reason it's out to consult is that we might have not got it right. We want to hear your views. We want to make sure that the network we're proposing long term works for you guys. We recognise as well that there's things that we probably could do more of, and this is the way that you can really get that through with kind of knowing how we can improve that bus network, Bath network for you. For example, we know that we've done a few public consultations. Some of the feedback we've got is people will be able to make it to like the park and rides, but then they're kind of stuck on how they get to the RUH and those types of places. So maybe we could work with the bus operators and WECA to try and put on these bus services. Obviously, the more people that feed that back to us through our consultation, the more opportunity, like it kind of strengthens those arguments. So all I would say is, even if it's a little thing that just makes your journey coming into Bath or out of Bath that little bit easier, please do feed it back through our website, because it's kind of like everyone gets equal weighting when it comes to their voice. So the more people saying it, it kind of strengthens that argument. So I'm gonna leave it there, because I can talk for ages, but I'm gonna just recommend you probably go onto the website, do have a look. There's an interactive map. It's got a bit more data, and yeah, I'm happy to. I'm gonna say this now. I'm happy to take questions, but please be nice.
Chris, you're muted, Chris.
Can you hear me now?
Yeah. Oh, sorry. How does this fit in with the current...
Chris Hounsell. Sorry, Chris.
Oh, sorry.
Warren. Yeah.
Okay, how does this fit in with the current WECA consultation about the Bath to Bristol corridor?
So the Bath to Bristol corridor does partly link in. Actually, it might be easier if I share the map, then this might be a little bit easier. Bear with me 2 minutes. So I can appreciate this is a strategy. So what this is doing is kind of setting out a long-term 10-year plan. It doesn't set out details as to what those types of projects will look like. But the reason being is that a lot of these projects that are being delivered, such as Bath Bristol Strategic Corridor, people are kind of questioning, well, how does this fit in with the wider network that we're proposing? So one of the other work pieces that was done across the wider area was creating sustainable communities. Again, this document was adopted earlier this year, back in February 2025 by the council, and that one set out kind of like wider opportunities of what we can do to improve sustainable transport in these areas. I'm just going to scroll through just to the map that's being proposed. So can I just double check, can you all see that on your screens?
Mm-hmm.
Perfect. Yep. So I appreciate this looks really messy, and this is why I was saying if you go onto the website, you can zoom in a little bit more. But generally what we've done is it's using data that we've got available. So the orange kind of corridors are where you can see like the bus corridor priority. Now, that's not to say that a bus lane will fully go on these locations, but typically it means when funding becomes available, this is kind of where we'll be focusing those corridors for improvements. So for example, on the Bath-Bristol strategic corridor, particularly along that Newbridge Road section in Bath, as you're just going past the Park and Ride. They're proposing to improve majority of the signals along there so that the buses can run a bit quicker, but they're also looking to build out the pathway so that pedestrians can cross a little bit quicker. And again, that's kind of improving the bus corridors in that, the bus journey times in that specific area. Does that help a little bit? I appreciate it. Strategies and kind of linking up with the delivery can be quite tough. It doesn't, but it's, yeah, it's meant to just give like that high level aspiration for the area.
And are you linking in with the railways as well?
So one of the things we focus on with this is what we can do within the council. So we're working with Network Rail, but we recognise that we don't have the power to do that. But the next side across does recognise kind of all the wider things that are going on in the area. So we are working with WECA and also neighbouring authorities like Wiltshire to kind of promote other things going on. So like the Salford train station, Keynsham train station, because by doing that, obviously it does help to support other communities kind of getting in instead of by driving. The other big thing probably to note as well is, so there was a recognition by National Highways that the M4 to Dorset coast was somewhat of like a missing link. And earlier this year, it was announced by National Highways that they would focus on improving that A350. So that's the corridor that goes past like Chippenham down to the south coast to become a bypass. Benefits for us within Bath and like northeast Somerset as well is it means that HGVs, if they're coming off of the motorway, whilst they shouldn't be going through Bath and through North Somerset is anyway, it does promote them using that corridor to go down to the south instead of using these alternative routes.
Okay, thank you for that.
Thank you.
Rob?
Yeah, obviously your map comes up as sort of just across the boundaries from Keynsham. Purely for this meeting, I think a lot of people are concerned about the bus gate going down the A4 and the little sort of scooters and everything going through the park. I think there's a plan for it to sort of offshoot into the park, isn't it? For
Are we
scooters
talking,
and things.
is this specifically the Keynsham section?
Yes.
So that particular section of the Keynsham area has actually been taken out of the public consultation at the minute. The public consultation is only covering from, I want to say it's the Broadmead roundabout from sort of just on the cusp between Keynsham and Salford, all the way into Bath up until New Windsor Bridge. I always get the bridges wrong, sorry. So that's the link it's covering at the moment for the consultation. That consultation is running until the 2nd of December. The reason being is because the mayor gave, as part of her manifesto when she got elected, was that she would remove the 24-hour bus lane proposal on the Keynsham High Street high bypass. So what's happened is the team have had to go and speak with the mayor as to what alternatives could be proposed if it needs to. So those are on hold just whilst the consultation is going forward for those other areas.
Brilliant. I'll get back in my box.
No,
Yeah,
absolutely fine.
Sam, just as you know, on that similar topic, I imagine you are aware that the park in Keynsham that they wanted to build a hub on is part of the conservation area in Keynsham.
Yes, so I believe the team are working with the parks team who manage that site, because I believe they've done a master plan in that area. So they're still working on those various different work pieces. But like I said, that area is on hold at the minute because we don't know what the bypass can look like. So we can't even propose if there's going to be a mobility hub. That's still all on hold at the moment.
Perhaps they'd like to work with the people who are elected by the community to represent their views.
Yeah, I can definitely feed that back. I appreciate they've been to consult in Salford and along those locations already, but I can feed that back to WECA.
Okay, Chris Warren, you've got your hand up. We'll make this the last one.
Thank you, Alan. Just a quick question for Sam. As Bath and North East Somerset Council are the Highways Authority, who has the final say on any modifications being made to the A4? because I was speaking off the record to someone who works at Baines in the traffic department, and they were raising massive red flags about the Twerton Fork junction modifications. And anyone with any modicum of intelligence can see that that is going to cause enormous problems for cars and buses if that gets implemented. And just to pick up on Alan's point, I actually got elected back in January, my complete opposition to this whole bus lane proposal. So if you're looking for a relatively recent opinion poll, what people actually think, you could kind of look at that. So yeah, I'm extremely skeptical about any modifications or any fiddling with the A4. It works as well as it's going to work, and I think it would be a complete and utter waste of public money doing anything with the road as it is at the moment. It will not make any difference, trust me. Anyway, thank you.
Thank you, Chris. We'll call a halt to it there. The only observation I would make, Sam, is that that field behind you could take quite a few houses for the city of Bath. Just have to see whether it's on a plan anywhere. Okay, Sam, thank you very much for coming along and giving us the information you have. Very grateful. Thank you.
No problem. Thank you.
Where are we going now then? We're going now to Phil Waters, and Phil is head of partnerships and the main theme of local health and well-being services. Phil, you have half an hour if you need it.
Oh, thank you, Alan. I really don't want to keep you away from Coronation Street, so I'll be as quick as I can. I've got a short presentation, so I hope that's okay just to share, but it should be no more than 10 minutes.
Yeah.
Let me just get that up for you. Right, can you see that?
Not at the moment. Is
that better?
Yeah.
No,
it's there.
You can see that. All right. Okay. Sorry, I've started at the end. That's no good. Shall I make it full screen? Would that be helpful? Bear with me. Great stuff.
Yeah.
Right. Fantastic. Please do shout if I can't see anyone. So I'm just looking at the presentation. So I'm just going to talk through this. So as you can see, I'm from HCRG Care Group. So we are a community health organisation, and I'm delighted to be invited here this evening. So I'm going to be talking to you about our community healthcare services that we provide. But just before I do, back in April, we started delivering work across our healthcare system. Now we've been doing that in Bath and North East Somerset and in Keynsham for a number of years, but we've now expanded to deliver this service across both Swindon and Wiltshire as well. And really the vision, and the reason I've got this triangular slide up, is because I wanted to share with you a little bit about what we're hoping to put in place. So we're really interested in providing some of the things that Dan talked about earlier with the NHS 10-year plan. So really trying to support a digital structure, so online platforms that can support people who are digitally able to look after themselves, to do some self-care, to be navigated to places where they can get support online if they can do that. But we're also wanting to support that with something called a single point of access with care coordination. So essentially, this is a phone line where people are going to be supported to navigate what can often be a really complicated and complex process of getting to the right healthcare support. And then alongside that, if you're moving up, I'm moving up the triangle if people aren't following, but in the middle, we've got our neighbourhood teams. So this is about bringing healthcare closer to home. So making our community healthcare support local to you. And then alongside that, we've got our specialist services and our community hospitals right at the top of the triangle. And really, we want to prevent people getting to this level of support, but we recognise that it is needed. So we've got our community hospitals. So the closest one for yourselves is over in Poulton. There's also St Martin's in Bath, and then others in Wiltshire and Swindon as well. So there's a whole range of services that we provide, and I've just wanted to kind of, before I talk about the services, I wanted to share a little bit about our, like the goals, the things that we're trying to achieve in reshaping our services in the way I've just described. So we're really focused on improving the health and well-being of our people, increasing overall life expectancy, reducing the impact of long-term conditions, improving access to care, and improving the experience of care, and that's really important. And we're also looking at trying to improve that sustainability of our workforce, and at the bottom there, just making the best use of our digital technology. So I'm not going to spend long on this, but this is just, at the moment, we're in the process of trying to create this, present this in a more accessible way. But this is a list of all the different community services that we're providing across Bath and North East Somerset. And there is a huge range here. Just to translate some things for you. So LDAN on the left-hand side, that stands for learning disabilities, autism and neurodivergence. So there's a range of community services that we provide within that bracket. The CYP, so that's standing for Children and Young People Pathways. So there's a whole range of support specialist services that we're providing in the community around children and young people. And then on the right hand side, you can see a long list of adult pathways. So these are community care support services that exist within the community, and there's a whole range of services there. So I'm gonna skip over that, but I just wanted to give a bit of a indication of the scale of services that are provided. So we started delivering this broader range of services in April, and I just wanted to quickly talk about some of the things that we're trying to do. So in our first 6 months, we've brought across a number of staff from other providers. So we've had to try and bring those staff on board. Across Baines, Swindon and Wiltshire, we've transferred over 2,500 staff into our organisation, and as you can imagine, that's taking a long time for us just to make sure that they're settled, to make sure that they're fully supported, and that they're able to carry on and deliver the work. So our priority was making sure there wasn't any impact for the patients, but also making sure that we were empowering those staff and making them land well at HCRG. So first 6 months been a real focus on that, and then alongside that we've been trying to give ourselves an identity that actually makes sense and says what we do rather than HCRG. So we are in the process of finalising an identity, and at the moment Bath and North East Somerset, Swindon and Wiltshire Community Health is where we are, and there is a survey, as you can that I've just got up on the screen, and I'll circulate this information in a moment. But if anyone's interested in helping us shape what our brand identity could look like, there's a survey that we've got out at the moment, just hoping to finalise this within the next month or two, so that we can start talking about ourselves in an identity that makes sense. So we're in at the end of March, we'll finish our year one, and by that point we really want to be working in a much more data-driven way. So part of our commitment is to really use data about where people are unwell and use that to be much more sophisticated in how we identify and provide that support. And some of that will sit around our integrated neighbourhoods teams. So we want to make sure the staff in the communities are based in the places where you, our patients, need us most. And alongside that, I talked a little bit about our single point of access and care coordination. So we really need that care centre to be up and running so that people can be supported and navigated well. And alongside that, having the beginnings of our digital front door. And Sarah was with us at a workshop earlier today, helping us look at what that could look like and learning from the Wellbeing Hub and how they do things. So by the end of year two, we really want to make sure that people are telling their story to us once, making sure that people aren't having to continually tell us what's wrong with them, and we can have a single kind of assessment that follows people through our system, through some of our digital support and innovation. Estate strategy. So essentially we're talking about the places where we deliver our services. So we want to make sure that we're doing that in a way that's sustainable, and we've got estates or venues that are in the right places for our communities. And then, yeah, by the end of year two, a big part of what I'm here to do is to ensure that our VCFSE. So we're talking about our voluntary community and our social enterprises and faith partners in the local communities are part of our system of support. And we're really committed to making sure that we're working together with our different community partners to achieve that. So I just wanted to summarise. That's it from me, really. I can talk lots more about this, but I wanted to keep it fairly concise. So there's a few bits of information here. I'll make sure these slides go out through Mark. But yeah, there's a website called Start, Live and Age Well that has lots more information on who we are and what we're trying to do. I mentioned the brand identity survey that's out at the moment. So there's a hyperlink in there. We've also got a sort of a general survey that's open for people who've used our services to help us shape and improve and give us feedback on what works and what doesn't, so that we can continue to learn from that and ensure that we're developing our services. And there's a whole range of other pieces of engagement that's going on. We're working with our local partners, we're working with the Wellbeing Hub, we're working with our primary care partners. So we heard from Dan earlier and the Federation, and of course our voluntary and community sector partners. And yeah, it's wonderful to be here tonight to talk with you a little bit more. So I am going to stop sharing and I will hit send on the survey. So there's the 2 links there for the surveys that I've mentioned. I appreciate there's a lot of information there, but yeah, I'm open for questions. So Martin, I can see.
Yeah, can I come in, Alan? Is that?
Yeah, of course you can. Yeah.
Sure. I mean, you skipped over very quickly, but it really interesting presentation. You deal with children's services, and we hear in the press huge demands on children and young people, long waiting list, causing huge pressures on young people. So with all this, what are you doing to try and reduce that big waiting list, people waiting so long for assessments and things like that, particularly in children and young people?
Yeah. So if you're talking specifically about autism and learning disability diagnoses. So that is that part. So we're part of the system that is supporting around that. And yes, there are significant waiting lists, and that is a national problem. But we also are experiencing that locally. I think it's the reason I say it's a national problem in that I think things have changed. I think awareness has grown a lot in the last. In fact, I should say my background. So I've worked in the voluntary community sector my whole career, and I've come from an organisation called Off the Record, based in Bath and North East Somerset. So it's a really familiar space for me in terms of talking about emotional health and well-being. And yeah, I think it's a very significant issue. And I know within HCRG and our health services, there's a whole piece of work looking at the understanding the pathways, understanding how people access our services, but also a whole piece of work around how we're supporting those people that are waiting. And I think that's really, really important. And actually, this is where partners like Off the Record and other organisations that can provide support in the community are absolutely critical. And so we're part of the reason HCRG have brought myself into this role is to really understand and work with our communities more effectively to ensure that those support mechanisms can be put in place, or at least we can more helpfully work together to support those individuals that need it most, like those young people. But Martin, it's a great question, and I think you're absolutely right to raise it, and we're absolutely committed to trying to locally improve how we do that. But the whole purpose of our services is really to prevent those issues occurring in the first place. So we're really hoping that things like that digital platform we're creating could support parents and carers perhaps to be signposted to other avenues of support early on.
Does that include
thanks
as well? Then? Does that include?
Sorry, Alan.
Yeah.
So yeah, we do. So CAMs are we don't deliver CAMs. That's right. Oxford Health delivered CAMs here in Bath and North East Somerset, but we are absolutely working very closely with them. It's one of those services that crosses over quite a lot. So although we do some of the diagnosis piece, they're very much on the more significant support end and therapeutic side of support.
Seems to be a very well, you hear people talk about it, a very long lead-in or a long waiting time, should I say?
Yeah, it can be, and I know from my experience off the record, we supported hundreds of young people that were waiting for CAM support, and it's yeah, it's really challenging for all those services, and for the young people, of course. Any other questions?
I think your presentation was, oh, Adrian will be in a moment. I think your presentation was really good, well, good, but it brought a lot of information that, you know, perhaps most of us haven't got. And as you say, you've supplied the my echoing or talking over some, but sorry, Adrian, were you? No, go on.
If I could, Alan, please.
Yeah.
Yeah, I mean, I'll just briefly pick up on Martin's point, because somebody has taken me nearly 2.5 years to try to get a education and health plan kind of assessment for my niece's daughter. I can verify what a nightmare it is, and the need, I think, noticeable that because of the limitation resources and stuff, you have to be a really high need to access some of these issues. CAMS in particular is one I'm thinking of, and I think for a lot of people, where those early interventions is needed and the outcomes are a lot better, they're not getting those early interventions, and so I think the resources are so intensive farther down the line, where they needn't necessarily have been if those interventions would have been there an awful lot earlier. But my main question was really around being one of the older people on this. I've seen much more fragmentation of health services over the last few years, with a lot of it going to the private sector, to the community, so on and so on and so forth. One of the things I found is the lack of communication between those organizations, and it can be so frustrated for the actual patient. Sometimes been having to repeat themselves umpteen times, sometimes having to chase things because phone calls haven't been followed up, appointment, referrals hasn't been followed through, and so on and so forth. And just as an example, just this weekend, where the wife was today, where a set of x-rays that was taken at the walk-in centre in Hen Grove couldn't be sent to the RUH, and had to be repeated again once the wife got to the RUH, causing a lot of discomfort, a lot of time wasting, and obviously a delay in being able to give her the intervention she needed to sort things out. So I know it's an ongoing problem, but it's one which seems very, very difficult to resolve. And the more fragmentation we get, the harder it seems.
Yeah. Adrian, you're not unique in sharing those sorts of challenges. Unfortunately, although our digital systems can be really helpful and supportive, there are times when that can be a real barrier too. So I really hear you. I think part of what HCRG are hoping. Oh, do you mind, maybe Adrian, would you mind muting? I'm wondering whether there's an echo.
Oh, sorry, let me turn me.
That's it. Thank you. That's better. I was just going to say part of what HCRG is trying to do is to be more coordinated around those digital systems. And there's a huge piece of work we're doing at the moment, talking to our partners in the hospitals, so the RUH, and our partners over in SFT in Salisbury and also in Swindon, GWH, around how can we make sure our systems, there's no blockages, so that those pieces of key information are flowing from the hospital to the community, and then also to our primary care partners. So Dan, who you heard from earlier, talking about our GP practices. So sadly, there are barriers sometimes that exist between those different systems. And I think it's, well, as far as I see it, it's our responsibility to ensure that they don't exist, and they don't inhibit or prevent patient experience where you need that information to flow. It's a very real issue, and I think there is always a solution. It's just about finding the right ways through that. And I guess all I can do is let you know that we are doing everything we can to overcome those barriers. Yeah, and I'm sorry you experienced that. Any more questions? Or is Alan going to get to see Coronation Street on time?
I'm trying to unmute myself. Terrible, isn't it, really? Most people prefer me muted. Are there any other questions? Phil, I think you've obviously given everybody everything they want to know, but equally with your papers being circulated, it will make a good reference point together with Dan's papers earlier. And our last, so thank you very much for your presentation.
Pleasure.
Sarah is going to talk to us about the Community Wellbeing Hub.
Yes, and I'm going to do it, Alan, in 10 minutes to get you to the telly on time, and everybody else. I like Coronation Street, so I want to get there too. So I'm going to talk to you about the preventative offer. So Phil talks about obviously the community health services, and I'm going to talk to you a little bit about the Community Wellbeing Hub being the preventative offer, but also some other useful tools for you as community leaders and key organisations in your community that you might find really useful. And I have a really short presentation that I will share. It's mainly to keep me on track, otherwise I do have a tendency to go off at a tangent. So what I wanted to share with you today, and some of you may already know some of these resources, but I wanted to focus particularly on the Live Well resource, talk about the Community Wellbeing Hub, and also the Wellbeing courses as well, which is a new service that the Community Wellbeing Hub has recently got funding for. So firstly, I wanted to talk to you about the Community Wellbeing Hub, and some of you may be aware of the hub. We certainly worked closely with Salford and Keynsham and some of the parishes during COVID, which is when the Community Wellbeing Hub was set up. And we're a partnership of we're close to 40 partners now, all commissioned and contracted partners either by the council or the NHS. And what we try to do is bring together the services under one umbrella to make it easy for people to access a range of service around health and wellbeing. So what we found out during COVID was that often people when they asked for help, they often needed more than one support. So they generally, if they were coming in for financial support, they often had other multiple things going on around that person. So one of the things that we've been trying to do is create, and Phil talked about creating this digital front door. We've been trying to create in a similar way, a single point of access, a digital way, but also allowing other ways for people to access the services. So if you contact us, contact the Community Wellbeing Hub, whether that's through the telephone service or through our online form, you can connect to the right services at the right time. So we drive the contact and referrals around the person's needs, rather than you having to know what services relate to what. And we've done quite a lot. Alan and Adrian mentioned about the hospital provision. So 3 years ago, we worked with the IUH directly to improve access to community services. So when you are discharged home from hospital, the voluntary sector and the community, there's a wealth of services available. And often what was happening, it was dependent on the different wards having that knowledge and information. And what we've done now is create a unified, a standard approach to supporting discharge. So we have teams of staff that are in the hospital that promote the services that are available in the community. So we hope that we are improving the discharge home for people, whether that is the short home from hospital service for 4 weeks, or enabling them to get out and about when they get home, or connecting them to other support groups, or receiving financial support. So what we're trying to do is build a network of statutory and commissioned partners, but also improve access to these amazing services that we're very fortunate to have across Baines. As I said, you can refer to the hub, and there are different ways of referring to the hub. For a professional or a volunteer, you can refer directly from our website through the online form, or you can call our central triage service, and self-referrals can be made via the telephone service also. What we say is for an individual who needs support, there's no wrong door. So if you reach out to Bath Mind as one of our partners, or the village agents, then those partners will connect you to other services. So we're not just signposting people to support, we're actually actively making referrals so people can get the right support at the right time. And I think what's really important to say about the hub is that partners work very closely together. So when people need multiple services to support their needs, they work together to coordinate that support. I also wanted to refer you to a really amazing resource. It's a directory of services called Live Well. It sits on the council's website, but the web address is on bottom left. And it's a huge resource of information about support around for families, for information for children and young people, and for adults seeking support. And it ranges from groups and activities to self-help information. It's a really great resource, and it's free to use, and it's available and regularly updated. So do share that, or use the Live Well resource as something that might be useful for you in your roles. We've also recently, in the Community Wellbeing Hub, secured funding to continue the service that unfortunately HCRG were no longer able to continue running at the end of April, which is the Wellbeing Courses offer. So again, like with our services, that we have an amazing range of different activities and resources, and often these courses and resources and activities are really valuable to people to reduce isolation and loneliness, to connect people into their community, to support their general well-being. And one of the things that we wanted to do was support our preventative offer by continuing the wellbeing courses. So we relaunched the wellbeing courses on the 6th of October, and that resource is now available. You can use the website to book onto courses. Some of them are free courses, some of them are paid for courses, and we're also trying to encourage as many activities and courses that our partners are delivering and wider to be promoted to the wellbeing courses. So you have one place to go to connect to all of these amazing offers available for our community. And then a final slide, really, just to show the breadth of the partnership in the Community Wellbeing Hub. As I say, we're close to about 40 partners now. We've got some new partners coming on board that have just been recommissioned as part of our recommissioning offer. And we're really delighted to be working with partners, and HCRG are one of our partners, and we work with them in the community hospitals. And as Phil said, you know, we're supporting them in their transformation program and seeing how we can improve that connection to make sure it's easily accessible for people to get the support they need at the right time. That's me.
Beautifully done. Any questions of Sarah? No, that's not bad then, is it? My only question would be, how does one become a partnership or a partner within that partnership?
So because of the data sharing and the systems, you have to be a commissioned or contracted partner. Yeah. And so one of the things we want to see and look at developing is, how do we connect all of the other amazing voluntary sector community organisations? How do we connect them into the partnership? So part of that is through the wellbeing courses offer. So it might be that you have an activity or an event that we can promote, and obviously the other part is the Live Well directory. But what else can we do to connect all of those services? So we are looking at how we can sort of have that wider affiliation of the other partners across the area, because we are very lucky in Baines to have an amazing, very strong third sector community organisations, a lot of grassroots organisations that do amazing services, and we need to make sure people have access to them when they need it.
Okay. And nobody else has their hand up. So could I thank everybody for attending? You've been very good. And everybody's kept to their time. We're looking to sort of come together again. Four dates I have for you. If of these, is this paper gone out to everybody, Sarah, or are the dates that I have here in front of me new, as it were?
I'm gonna have to direct that to Mark, because he does all the administration. No, that's okay.
Yeah, they have been circulated on the agenda, and we are just looking for a venue for the June meeting, because the community space isn't available then. So we may look to change that date or go to a different venue for that.
Or if anyone has any venues that we could come to, then let us know.
Well,
absolutely.
I mean, there's a Baptist church in Keynsham. I mean, there's a slight fee, of course, but
yeah, we can look into that, can't we? We'll take that one away.
We can.
Thank you.
All right.
Yeah, that's great. Thanks,
okay.
Alan.
Right. Well, again, my thanks to everybody who has attended. For those who come first time, I hope you'll come again, because the forum only works if we have a wide selection of people as part of it. And yeah, it's all been good, and I'm sure that next year will be equally as good. So all I would wish you is a safe journey home, or a safe journey from your bedroom to your lounge, and a Merry Christmas as well, and a Happy New Year. So we'll see you all in February. Thank you very much.
Thanks so much.
Bye.
Thank you. Bye-bye.
Bye-bye.
And there they were gone.